Hey everyone, welcome back to all my listeners. Now I hope you're all having a great day so far. I know I am. Now I hope you all had a wonderful weekend. Watched some Super Bowl, enjoyed a nice Valentine's Day. Hope the month of February is treating you all very, very well. So welcome to my 7th episode of Season 5. Today is Wednesday, February 16th, 2022. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, guys, I've got so much to get into today. I'm going to be diving into my compliance tip today and letting you all know about the new Hickpix code for COVID-19 Convalescent Plasma. And I'm going to be rolling out that red carpet once again and introduce a very special guest, a return special guest, and my very good friend, Rozmin Bapat. And I close out today's episode with some inspirational words on clarity and focus from Bill Gates. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organization, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and recommendations based on my over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So let's get into a very special Newsworthy that features my guest today, Rozmin Bapat. Now, we all remember my friend Rozmin from season 3, right? And her incredible journey towards becoming a female business owner of Code Right Healthcare Consulting in the Dallas-Fort Worth area of Texas. So I just simply had to bring her back on with me to discuss her latest tips and tricks and her latest rants on a big issue that so many of us think is so unfair. So I can't wait to unpack all of this information. Welcome back, my friend. So good to see you here.
Thank you. Thank you for inviting me back. Happy to be here and great to see you, Sonal.
Yeah. Happy New Year. It's going to be a good new year. Fingers crossed, right?
Absolutely. Absolutely.
All right. So why don't we start with some good news for 2022? I'd love for you to share some rosy light on all of your tips and tricks that you can share with us for revenue cycle in 2022.
Well, revenue cycle steps and tips haven't really changed in the new year. They're still the same, and you still have to go through a process in order to have a foolproof revenue cycle. So let's get started with the first thing, which is to acquire accurate information from the patient. So it includes their demographics, their name, last name, first name, date of birth, address. All of those things have to be so accurate that it matches what the insurance company has on file with them. Let's say a patient has a nickname, correct? So you don't want to put that nickname in the system where it'll get pulled into the claim, because if it gets pulled into the claim's going to get kicked back or rejected, first from the clearinghouse, and even if it makes it through the clearinghouse, it'll get denied at the insurance end because they're not going to recognize that patient. So we have to make sure that everything that we get from the patient is accurate and matches what the insurance company has on file. So that's number one.
Perfect sense. That makes perfect sense, right? So like if Bobby is a pet name at home, it's important for that patient to come in. Yes, he can identify himself as Bobby, but it's imperative that the front desk takes that insurance card from Bobby to recognize that actually for the insurance company and the payer all of that, his name is Robert, right? It's not Bobby. That particular payer's card will say his name is Robert. So yeah, that's a very good point. Excellent.
Correct. And you can actually put Bobby in there in the system. There are fields right now in the software that you can put it there, but it's not going to get pulled into the claim. So you can do that. But if you put it in the same field as the first name, like in a quotation marks or something. So for example, if a patient has a nickname, like you said, if the patient's name is Robert and they go by Bobby, that can be added into the system. So the next time patient comes in, they're addressed the correct way, the way they want to be addressed, but then put it in a field where it doesn't get pulled into the claim. There's usually a field for a nickname on the separate from the first name. So if you're putting it separate, then it's not going to get pulled into the claim, and the claim will pass through without any difficulty. So that's one thing. Another thing I wanted to say was that obtain correct insurance information from the patient. So we advise the practices to scan the patient's card at least once a year. And this is very important for Medicare patients because, you had a Medicare patient come into the office for a number of years, right? And they've always had traditional Medicare and a secondary. But a lot of times, seniors do get tricked into signing up for Medicare Advantage plans, and they don't even realize it. And come January, they have already signed up for a Medicare Advantage plan. They still think they have Medicare, which is true. Medicare will show up as active coverage, but now that replacement plan, the Medicare Advantage plan, has replaced that traditional Medicare. So it's very, very important for the practice to get both of those cards and to see that, either it's a traditional Medicare and secondary, or it's a Medicare replacement plan or a Medicare Advantage plan. So that's extremely important. A lot of times seniors don't know. So the office staff needs to be trained enough to be able to help them with that. Nowadays, and also have them verify their information, like, their address and things like that. I remember before, patients used to get a, clipboard with papers, in the registration forms that they had to fill out every year, and they didn't like it. It's like, I just filled it out. Why do I have to keep filling it out over and over again? So nowadays, you can just hand them a tablet. Everything is auto-populated, and then all they have to do is verify that the information is correct. And that should be updated at least once a year. That's also very, very important as well. Next, it's the entering of the data, making sure that all the digits in the member ID card are entered correctly.
Right.
And, the alpha prefix for Blue Cross Blue Shield, for Medicare, now we have these, letters and numbers together. An interesting thing I'll tell you is that the Medicare card has dashes in them, right? With the Medicare number, but you don't add the dashes when you enter the number into the system, because the claim, when you send in the claim, the dashes are not recognized, and it's going to throw it back. So one time I remember I had talked to somebody, and they said dashes are a death of a claim. That's what they said to me. So I always remember that, and every time I train somebody, I say the same thing to them. A dash is a death of a claim, and I know they'll remember it too, because I have not been able to forget that, and that just like stuck in my memory, right? So do not add dashes, and do not add special characters.
No special characters.
When you're entering the patient's ID card. And it's also, as I mentioned, it all starts with the front desk. If the things are done correctly on the front end, then the rest of the revenue cycle, the coding part of it, the scrubbing of the claim, adding the modifiers, and the billing team can take care of that on the back end. But if you don't have all the demographic information and things like that correctly in the front end, it kind of throws everything off, and it just unravels that whole cycle. So those would be my best tips in 2022.
Well, I love those tips for 2022. And I'm going to agree with you, because I think our front desk is so important, right? All of those steps and procedures that you just outlined, I think are critical. If they're missed, right, we see the trickle down effect, the domino effect that happens in the revenue cycle thereafter, right? So yeah, I'm going to agree with you that it's important to ask your patients to, open up those pocketbooks and, slap out all of their insurance information, right? Whether it's one insurance card, two insurance cards, or three. We would like to see all of those cards, and we can help you figure out, right, how to address which insurer is primary, secondary, or tertiary even. So I think it's important that we really do help our patient population and just get things done right the first time. And I love those tips for 2022. Absolutely. Let's applaud those people at the front desk, because they're the ones who really do start the revenue cycle off in the right direction and prevent all of those hiccups from happening in the end.
And that's correct. And I will add here that I know medical practices can get very busy. And I know that, you're just like, checking in patients and getting them roomed and all of that. But, customer service goes a long way.
Yes.
The patients are always going to remember how you made them feel. And of course, the doctor will take care of that at the back, and everything. But it all starts with the front desk and a smiling face and a wonderful greeting. That all counts towards the success of a practice.
Well said. Yes, I completely support that, right? If a patient is treated with a happy mood right in the beginning, I think that's incredibly important, not only for the rest of the time that the patient is in the office, but, they will be a repeat customer in that sense of the word, right? It is about patient satisfaction. And that does start right when they open the door to the office. So yeah, love that. Love those tips. Wonderful. All right. So why don't we move on to my next question? I want to hear again all of your advice on something a little bit different, but I know that you and I love to help our providers in addressing revenue leakage, right? How can we help our providers capture more reimbursement when it's possible? So how do you address these types of issues with your clients that you have today when you're reviewing all of their documentation, their billing practices, everything?
So revenue leakage, and there's multiple ways that can happen. It can be like, at the front end, right, where you don't have the right information, when you're not collecting the right patient out of pocket. Those are the things that are important as well. But another thing that contributes to it is the coding part of it. And what we try to do a lot of times, what happens is that, the doctors will want to add services and then add those modifiers, but we know that a 25 modifier or a 59 modifier, the overuse of those modifiers do raise a red flag and do flag those claims to get audited. And you as an auditor and being in compliance, that it's not a matter of if, it's a matter of when.
Correct. So
proper education is very important. We're working with a client right now where we're dealing with a lot of LCD issues, a lot of NCCI edits. There's some policies that have been put in place towards the end of the year, where the diagnosis codes that they have been putting in for a particular CPT have been getting paid for a number of years, right? But now all of a sudden, that diagnosis is not in the list anymore in LCD, and the doctor is completely confused as to what am I doing wrong, what's going on. So those are some of the things. I know being proactive is key, and then you should know these things ahead of time. But sometimes the claim denials also teach you these things as well. So the key here is to take that step right away. And when you see that denial, you make that change and you educate the provider in what codes are going with, what diagnoses and things like that, and then have a lot of evidence backing you. Because I also posted the other day on LinkedIn that just because a CPT code is there doesn't mean you can always bill it, because there are exclusions and there are bundled services and things like that. And just adding that 25 modifier or that 59 modifier is not a guarantee that it's going to get paid.
Right.
So those are some of the things that we educate our providers on. And of course, like educating the front desk and the billing, we also do the oversight as well. So if the billing staff is not well versed in coding issues and coding related issues and stuff, we do try to educate them. But education is key, and training is key. And for ourselves as well, trying to learn and trying to stay ahead of the curve all the time, trying to see what is coming down the pipeline, especially for the practices that we serve and the specialties that we serve. I want to make sure that my team knows that, if there are changes that are coming down the pipeline for neurology or for cardiology and some of the specialties that we support, that we know those things before these things are rolled out. Sometimes, most of the time we're able to do that. Sometimes we're not. Sometimes a denied claim here and there can tell us the right thing, but then the key is to implement those changes right away and then educate the providers and what to do in the future as well. So front end training, and then of course, provider training for coding and modifiers and all of those things is also very, very important.
I love it. I love what I'm hearing from you in terms of all that you also do for your providers, for your clients, in terms of staying on top of the changes, right? On top of staying current with everything. Like, for example, we just ended up in 2022, right? It's a brand new year. There's that entire new CPT code book for 2022, right? Mm-hmm. Massive changes. So absolutely correct. We need to be aware of the changes and how they're going to affect our providers, right? So that education is definitely key, not only for CPT codes, but like you were saying, for those LCDs and the diagnosis codes that change as well, very often from quarter to quarter. So that's a very good point that you bring up, that when our physicians are confused on particular services that they've been receiving their reimbursement for so long on, they're confused as to why all of a sudden has this changed, right? And if they don't know about that LCD, right? If there's no citation for them to go ahead and review on their own, they simply would not know why this big batch of, the month of January's claims have now come back not paid. So I love to hear the fact that you do go ahead and go that extra step and provide that detailed information to your providers. Absolutely. I love hearing it. Love it. Really good, spot on tips on revenue. So awesome. Keep it up. Now, why don't we move on to my next question, right? So this is going to change course slightly here and talk more specifically about our coding professionals, right? Our colleagues. So as a business owner of CodeRight, what do you think is the significance that you see between experience versus certification? Is there a difference? And what makes some of your best employees, in your opinion?
So I have certifications and I love certifications. They do give you certain prestige with having all those letters next to your name. And I will always vouch for that. But experience, it's something that I feel will probably, I would advocate that experience matters more than certifications. I started working in the trenches. I started working, front desk. I did billing. I did all the, the billing, coding, and all of that. And I didn't get my certification. Probably I was in the field for about 4 years before I got my CPC. Because at that time when I was like, okay, I'm confident that I have my hands, in all of this now, and I can study for it and I'll understand the concept. I have a lot of respect for a lot of the people who do go the other route, where they actually study and they get certified and then they start looking for a job. But I will tell you this, that not having worked in the industry and getting that coding certification is not really a lot of value. Sorry to say, but it's not a lot of value. Well, everybody that I have working for me right now is certified CPC, but when they did get that coding certification, they had a CPCA, and I, got them in as an extern, and then I hired them and everything. And I'll tell you, they didn't know a lot of stuff. The only thing they did was they just studied to pass an exam, right? The real world experience comes with, working in a doctor's office, or working in a billing company, or working, reviewing charts. I got my CPMA after I was, reviewing charts for 2 years. That's when I got the confidence. I was like, okay, I can audit. I wasn't really, that was not my designation. I was not really an auditor, but I was reviewing charts, and I was reading notes and things like that. And that gave me the confidence that I can go get another certification. And I did. Even with compliance, we started working with clients, and we were giving them advice, and I was looking things up and everything. And then I was like, okay, now I can go get a compliance certificate. I know that a lot of people probably don't have that kind of luxury to work, in the field before they get certified. But I do always feel that experience goes a long way. I know that there's a lot of newly certified coders who are not willing to compromise, like to get a job, to get their foot in the door. I feel like they're just looking for that remote position that'll pay them like $25, $30 an hour right off the gate. I just don't think that's reasonable. I also posted about that a couple of months ago. I know there are jobs out there. I know the newly certified coders do get employed in companies where they do get to work remote right at the gate and everything. But that's just so rare, I do feel that you should try to gain experience wherever you can. And if you can afford to, I know there's financial reasons and economical reasons as well, where people can't afford to just, go and learn something, right? So I do understand that, but I do feel that that certification is just a piece of paper until you have experience behind it. So I will probably say experience over certification all the way.
Well, I appreciate those answers. I'm going to have to tend to agree with you there. As I reflect on how I got here, that's exactly what I did. I got my certificate for coding and billing, right? I had transitioned into a completely different career. I had a completely different journey before this particular field of healthcare. But anyway, I got that certificate, and I decided I was not going to sit for a CPC exam. I wanted to get a job. So that was my mindset. I wanted to get a job. I wanted to get any job that I could with my new certificate of medical coding and billing, right? So I remember, pounding the pavement, trying to get that job, applying everywhere, being turned down. Oh, you have no experience. You have no experience. And then being disheartened. Well, how do I get experience? I'm trying to get experience, right? And eventually I landed at this really reputable, large, amazing, still standing in Houston today, medical billing company. Amazing. And the owner of that business, she took a chance on me. She interviewed me one time and hired me at the end of that conversation. The end of that conversation, she hired me. There was no follow-up, come back, talk to somebody else. No, she hired me at the end of that conversation. And it's through that kind of, you really have to persevere, right? And just believe in yourself and you can do it. So I agree with you. Go out, apply for jobs in the billing companies, at the front desk, in the doctor's offices, and just get your experience. I agree with you completely. And only because that organization valued the work I did, they supported me in getting my CMC credential, which is what they preferred at their organization, which is through the Practice Management Institute, PMI, which is based in Texas, who CMS recognizes as a great program, et cetera. So I got that handily because the employer requested it, right? And then eventually down the road, when I was working at MD Anderson, this was in 2014. This was years later that organization demanded upon their coders that after a certain time of employment, you get your CPC. So I did that as well, handily, worked every day, studied every evening, and passed that certification. So, it's a matter of timing and how hungry you are. So I absolutely agree with you that it is that work experience, right? It's all the records that you see, all the types of coding that you actually have that experience with. Because when I think back to 2014, first of all, that was a long time ago, but that exam was difficult. It was strenuous. It was 5 hours and 40 minutes in a room with a bunch of other people and one proctor. It was very stressful to master that entire code book, right? And if I didn't have that experience under my belt at the billing company for quite a few years, right, getting my hands on neurology claims and anesthesia and my favorite surgeries and all of it, right? I don't really know how well I could have done just taking that exam straight up, just studying and sitting and taking it. So that's just from my experience and yours as well. So there's two of us here that agree that experience does really have a lot to do with it. So yeah. And I'm not the best test taker either. So that's why I'm going to poo-poo on myself that I don't know if I could have done as well the first time I took it if I had no actual work experience, right? But I did very well and passed in 2014 based on that experience. I'm sorry, I think you were trying to say something.
No, I was saying that when you are taking an exam after you've worked in the field, even if for a year, only for a year, you understand the concepts.
Absolutely.
Like
so much better.
Like I said before, you're not just taking the test to pass it, and you're not just, it's not just like memorization and it's like, okay, this, that, whatever, and you're looking at the book or whatever, but things are really making sense to you.
Exactly.
And that's what I feel that we should be encouraging, that, work in the field for a little bit, and even like, I know that there's a lot of people that work in doctors' offices, that work in billing, and they work in billing companies as well. And they've been doing it for a number of years, but they don't have the confidence to go get certified,
right.
So just because they're not certified doesn't mean that they don't know how to do the work. You got to believe in their work ethic. You got to believe in the drive. Like you said, they have to have that hunger, the hunger to go and learn and do something about it. So that's why experience matters. Certifications will come if you feel brave enough to go there and get that certification and add that to your name. They're great. They give you that sense of prestige. They give you that I guess even with AAPC salary survey, they tell you that, you can make more money if you have certification and everything. And I think it is true to some extent, but but just because you don't have that certification doesn't mean you don't know how to do the work.
Absolutely. That's a great point to piggyback off of, right? Over these years that I'm working, I have the privilege of speaking to so many employees who, like you said, are at the doctor's offices, right? That literally help me do my job. So when I talk to them, they are so smart, so savvy. They know the practice backwards and forwards, right? they know the nitty gritty details in such a way that they can translate that information to me so quickly, right? So that's really well said, that it is that those years of experience, right? Sitting in that office, doing all of the billing, doing the coding without the certification, it doesn't matter, right? They are very bright, very intelligent, and so helpful when I pick up the phone and I need them to help me do this, that, or the other. It's incredible. And absolutely, you're right. Over the years, I know I've encouraged so many people to go ahead and sit for a certification exam, be it through the AAPC or AHIMA. It doesn't matter. Pick one, and just go for it. So yeah, that's absolutely true. Absolutely a great point that people are passionate in the jobs that they hold dear to, right? And they grow to be very fond of their providers, right? So they want to continue doing great work for their providers too. Love it, Rozmin. Great insights from you as usual. So now, before you go, I know you have to leave us, but this last question is one I really want to focus on, right? This last question, right? I want to go back to this rant that you went on a few weeks ago. So I want those things that really get our goat in this industry, right? For you and I specifically, because we are physician advocates, we are physician champions, right? I want you to help my audience understand what your latest rant was about when you received this overpayment demand, when you think and believe the payer is clearly at fault. I want you to dig into these juicy details for my audience.
I've had quite a few rants on LinkedIn. Let's just say that.
And I love them all. They're all wonderful.
I try not to be a whiner and a complainer, but sometimes you just have
to. You're not a whiner or a complainer. You're passionate and you're an advocate for the provider when you see that there's something just funny here, that the payer has done something funny. So I want to hear all about it. I want to hear more.
Okay. All right. So the one that you're referring to, it's a refund request for about the $2,000 that the payer paid, the provider that we work with, and a big payer. I'm not going to name them. And so what happened was the patient was seen in September and then again in December. So there are 2 visits there, with some procedures in there.
Okay.
And the patient presented with their card, everything. And this particular office that I'm talking about runs like a tight ship. Mm-hmm. They really do their due diligence in verifying eligibility. They get referrals, prior authorizations, everything. I mean, they're on top of things, right? So of course, they verified eligibility and they verified active coverage. Patient was active at the time. That's what it shows on the portal, on their insurance portal. They go one step forward and they actually even call, and talk to a live rep so they can get a reference number, which is a great idea, which is very smart. So they actually do that, and the coverage was active and everything. And the claim was, coded and submitted, and they paid for the September claim. They paid for the December claim. So in January, I get a refund request from them saying that the patient's coverage terminated in March of last year. Okay. So the patient's coverage terminated in March, but then patient was seen in September and then in December.
And then again in December. And then
they paid for the claim. Yes. How is it that now they're coming back and saying, oh, patient didn't have coverage all that time, that it terminated 6 months before? And it's just like, it's a head scratcher, right? It's like, how does that even happen? And of course, when I called and I spoke with the rep and I was like, how is this the doctor's fault? You tell me how is this the doctor's fault? If the doctor's office did all the due diligence and and everything, and it showed active coverage, and that's why we submitted the claim. And even if it was terminated, you could have denied the claim, saying, hey, patient doesn't have
heads
coverage.
Up, coordination of benefits. Exactly. We're done. We're out. Right.
Exactly. And that happens, right? And they do say that.
Yes.
And this was like a 6-month lapse. So it's just
that's really a long time. Yeah.
And then she's like, well, it's not the payer's fault either. She got all short with me and everything. And I was like, okay, so, and then she was like, well, ultimately it's the patient's and the doctor's responsibility. it's not the payer's responsibility. I'm actually trying to find some sort of a policy online if I can, or I'm going to probably ask the patient to share their policy with me. So I can read the fine print.
Exactly. Read the patient's
what,
policy.
Exactly.
Yes,
and see
yes.
what's in there and what it says. But as of today, I'm disputing it.
Yes. Good.
And the patient is cooperating because he does not want to foot the $2,000 bill himself.
Good. Absolutely.
So so we're trying to see what we can do. The doctor's very angry.
Mm-hmm.
You know, he's extremely
Rightly
unhappy that that this happened. And you know, sometimes yes, the office does drop the ball and everything, and it does happen, and you kind of have to eat that. But in this instance, in this particular instance, it's not the doctor's office's fault. And I understand that, okay, the coverage was terminated, let's say in August, and you still went and paid for it. I understand that. But you're coming back and telling me the coverage was terminated 6 months before, and
this
you
makes
still
no
paid
sense.
for it. Yeah,
right.
it
this
doesn't,
makes no
right?
Sense.
Yeah.
And
any intelligent person, yes, you know, when you're hearing this, you're like, this does not make any sense, right? So
it doesn't make any sense. And also, if the patient is up in arms, right, then the patient also has facts that, what are you talking about, insurance company? I was covered at that time, right, for the September procedure as well as again in December. So yeah, there's a lot of head scratching that is going on here. Yeah. I want to hear some more when you maybe get your hands on that patient's contract.
I will keep you posted. I'll update you, but I was just like, somebody's got to pay.
Yeah, someone has to pay. That's fascinating.
I don't know if there's another insurance company. So I told them, I'm like, you do not recoup any money.
Yes, don't recoup the money. Exactly.
So I wrote a letter that, you know, do not recoup this money. We will pay you back if we do get paid by somebody else.
Right.
You know, either the patient or if there is another coverage there, you know, if we get paid, then we can pay you back, but do not recoup it because I'm going to dispute that too. And sometimes, you know, it's really great when the patient is kind of on your side.
Yes, absolutely.
And this patient is just amazing. And he's like, tell me what I have to do. You know, so I have to write a letter to my senator.
Absolutely. I was just going to say, can you escalate this to the Texas Department of Insurance? That's another good
you can
place to go as well, and get them behind this whole sordid, you know, it's just a sordid ordeal. It's not fair.
Yeah, we've actually had that happen for another company, that a patient actually wrote the letter to kind of help with expediting everything. It was a similar situation a few years ago that had happened, and the patient, you know, they copied everybody. They copied the state representative, they copied the senator, the Texas Department of Insurance. They copied everybody, and that claim, that, you know, overpayment recovery got reversed and got paid again. So I'm like, okay, I know how this works. It's just, you know, it's frustrating that it's going to take so much time and effort to do this. But if you go the right route, things will come into your favor. But then these payers bank on the fact that you're just going to drop it. You're not going to like pursue it.
And that's what's sad, is because I like having folks like you on this podcast, because we are patients too, right? This could easily happen to you and I, to people in our own life, right? Where these things do happen. This is real. This is a real problem, that the payers just think that we're going to drop away and forget that this happened, right? And just quietly go hide under some rock. Like, no, there are so many people like this male patient who's a fighter and who wants to make sure that things are done correctly from this particular payer. And he absolutely should not be footing this bill. Yeah.
And may I add, it's a good thing that you said that, you know, we're patients also. So I know there are a lot of people who are listening to this podcast who are patients. Yeah. And I just want to tell them that if something like this happens, please help your doctor's office. Exactly. You know, it's your insurance company and it's your doctor who's, you know, taking care of you. And if they're trying to get paid for something, a service that they provided, don't just, you know, because I know that, you know, with coordination of benefits issue, a lot of patients just sit on that information. I've also gone through that a number of times. When my husband used to work at Baylor, he had Blue Cross, and every year they would ask for coordination of benefits, validation or verification. And every year I would have him call because of he was the policy holder. So I would have him call. I'm like, call and make sure you tell them we don't have any other insurance, and get on it. As patients, you have to be proactive.
Exactly.
So it's very important for the patients to take that, don't just sit on things when the doctor's office calls you and says, hey, your insurance company didn't pay us, or there's a little bit of an issue, please call them. I think patients should also call and help their doctor's offices out as well. So just wanted to put that in there.
Oh, I love that. No, I love that tip, because you're absolutely right. We need ourselves as patients, we need people to be much more literate about how healthcare runs, right? They need to be more literate and understanding of what those insurance cards in their wallets actually mean, right? It's important that they understand that this year they have this payer, right? When they leave that job, that benefit is going to go away. And 1 to 3 months later, a new insurance payer is going to take over. So excellent points that we as patients all have to do our part as well to make sure everything runs smoothly from start to finish. Absolutely. Because we don't want to be stuck with these, ridiculously high bills in 2022 and beyond. Absolutely. No, excellent points, Rozmin. I'm so glad that we had this conversation today. I've learned so much more today in this short time with you. I love it.
Thank you. And thank you for keeping me on track, because, I can go on. I could talk about this all day long. But
no, I know. And we have other topics that we'll dive into the next time you come back. But I think this was a wonderful, wonderful conversation I had with you today. So just amazing. I want to wish you all the best for the first quarter of 2022. All the very best. And I'm going to see you again soon.
Thank you so much, Sonal. Thank you for having me. And thank you for your friendship. I do cherish it quite a bit. So thank you for everything.
Absolutely, Rozmin. I'll see you next time. All right. And now it's time for my best practice tips in Trusty Tip. Now, there's something new in coding once again. COVID-19 has really made its way into our coding books over these many years, heading into the 3rd year now, right, with the coronavirus disease. So let's talk compliance with the new Hickpix code for COVID-19 convalescent plasma in the outpatient setting. Remember, on December 28, 2021, the FDA revised the emergency use authorization for COVID-19 convalescent plasma with high titers of anti-SARS-CoV-2 antibodies. Now, it's authorized for treatment of COVID-19 in patients with immunosuppressive disease or getting immunosuppressive treatment in the outpatient or inpatient setting. Now, some facts on what COVID-19 convalescent plasma is. So COVID-19 convalescent plasma is human plasma collected by FDA-registered or licensed blood establishments from individuals whose plasma contains high titers of anti-SARS-CoV-2 antibodies and who meet all donor eligibility requirements and qualifications. Now, convalescent plasma is qualified and labeled as having high titer anti-SARS-CoV-2 antibodies based on testing accepted by the FDA under this emergency use authorization. Now, qualification of COVID-19 convalescent plasma as high titer is based on the serologic correlates of neutralizing activity, which means the ability of the donor's antibodies to block infection by reference strains of the SARS-CoV-2 virus in laboratory tests. Now, let's get to the nuts and bolts of the code. So CMS created Hickpix code C9507 for COVID-19 convalescent plasma for use in the outpatient setting, effective on or after dates of service December 28, 2021. Now, CMS will release the April 2022 Addenda B That's just in a couple months. So the April 22 Addenda B on the Outpatient Prospective Payment System, the OPPS, Addendum A and Addendum B updates. So that will be on their webpage, again, in April. But until then, CMS does instruct us to submit claims using this new Hickpix code, C9507. Now, this long descriptor for this Hickpix code is fresh frozen plasma, high titer COVID-19 convalescent, frozen within 8 hours of collection, each unit. The short descriptor is COVID-19 convalescent plasma, and the reimbursement rate for it is $750.50. Now, huge, right? So I think it's very important to stay up to date on coding, even during this incredibly lengthy public health emergency status that we're still in. It's fundamental if you have Medicare as a payer to keep your eye on correct and compliant coding and billing practices and make sure you are adhering to them to ensure you're meeting the medical necessity from the very start. When the documentation paints the medical picture with clarity and vibrancy from the onset of care, a certified medical coder can then abstract codes with accuracy. And finally, I focus Season 5 Spark on clarity and focus. I want this 5th season Spark to be filled with the world's thought leaders, writers, artists, philosophers, everyone who inspires the need for clarity and focus in all that we do. So, in this week's inspiring quote in Spark is from Bill Gates. My success, part of it certainly, is that I have focused in on a few things. Absolutely true, right? I think this is a perfect quote that reminds us to focus on a few things. This selective focus, this clarity of vision, allows us to achieve success on the focused few. I am happy Bill Gates' spark still shines on in all of us today. So that wraps up today's episode. And as always, I appreciate you diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please have an amazing week ahead, and please continue staying safe and healthy. Thank you so much for listening in on today's very special episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.